The following Cardio-Oncology Spotlight was recorded at the American College of Cardiology meeting 2025. The meeting title was Advancing the Cardiovascular Care of the Oncology Patient. And there we had a chance to sit down with some of our colleagues who were speaking at the meeting about their individual sessions. We know you're going to enjoy these short but meaningful segments. Thanks for joining us. This is Steve Caselli. I'm at the ACC meeting in Washington, D.C. on February 15th, and I'm here with the president of ICOS, Dr. Susan Dent, and we're here with one of our colleagues, Kathy Ruddy from the Mayo Clinic in Rochester, Minnesota, and she spoke this morning on cardioprotection, so we're going to have a little chat about that.
Great, thank you. So thank you for taking the time out of our busy session today to talk about your session. At this meeting so far, we've heard about risk stratification and trying to determine who's at risk of cardiovascular toxicity. And of course, for those individuals that are at risk, the next question becomes, well, what can we do to try and ensure they don't develop cardiovascular toxicity, which brings up the whole topic of cardioprotection and prevention strategies. So maybe you could just sort of give us your overview. And of course, I have to point out you're an oncologist, as I am. So this is, I think, so important. Your overview, your feelings around the role of cardioprotection and really what that means for our patients with cancer undergoing treatment.
Absolutely. Thanks for inviting me to chat today. As you mentioned, I'm a breast oncologist. So for me, as I think about cardioprotection, the first thing that I think about when I'm seeing a patient for whom a cardiotoxic regimen might be useful from a cancer standpoint, I'm thinking about, first of all, lifestyle recommendations. What can we identify that might be modifiable in terms of exercise, weight loss, if appropriate, cholesterol medication, blood pressure. And so sometimes that means I'm partnering with a primary care provider or even a cardiologist to optimize that prior to initiating cancer therapy. When we're starting to talk about issues that might be developing during cancer therapy, then I'm almost always engaging with my cardio-oncology colleagues for help with medication initiation and dose titration as appropriate.
I think that's so important. You mentioned, at this meeting, we heard about the role of cardioprotective strategies in terms of medications like ACE inhibitors and ARBs and statins, and maybe the potential role for SGLT2 inhibitors. But I also think we can't forget about lifestyle modifications. And that's so important for our patients in terms of, exercise, diet, and so on. Having said that, what do you think are some of the challenges in implementing these strategies? Because, especially as oncologists, you're already speaking to individuals about their cancer diagnosis, their treatment, their outlook. What are some of the challenges you think we face in trying to implement some of these protection strategies?
I think it's particularly difficult right near the time of diagnosis, which is often when we're really trying to engage in these for a protective benefit, because patients are trying to figure out what they're going to do to treat the cancer. There's a lot of distress that comes with a new cancer diagnosis. So to add to that, and also increase your exercise and also change your diet and also stop smoking. It's just really a challenging time to be taking on all these other aspects. And for my patients, I practice in Rochester, Minnesota. Many of them are going to have traveled many, many hours to have seen me. And so the supports for example, the exercise need to happen closer to home. And so that's not something that I can necessarily set up for them right in my local community. I have to try to help them figure out a gym membership closer to home or other ways to support their exercise at a distance.
Given those challenges, do you think are there other members of the healthcare team that could assist in trying to implement some of these strategies? Because as you alluded to, that first visit, it's an important visit, but there's a lot of information for individuals to absorb, and it may be almost too much to discuss in one single visit. So what are some of the strategies and ways you think we could utilize the other members of our healthcare team to maybe, help get that message across?
I think that's very key. We do have physical medicine and rehab physicians who actually have a cardio-oncology rehab clinic. Some patients are able to have those visits. Not everybody can fit that into their schedule. We have wellness providers, wellness counselors actually, who provide both in-person and virtual care to patients. Primary care providers can be very, very helpful, especially for patients who have close relationships already with a primary care provider. And I think there's probably opportunity to engage others as well. What have you found, Susan, to be helpful in your clinic?
So I'm in an environment in a clinic now where we're fortunate to have allied healthcare providers right in the same building. So we have an exercise physiologist, we have a dietitian, social work, and so on. But of course, everyone's different and have different environments. But I think setting up a system where you can engage other healthcare providers, ideally closer to home for those individuals. So it does require, I think, a little bit of a heavy lift to try and get that set up in your local community. And so depending on where you practice, that's going to vary. So I just think it's so important to think about that, because we can talk about these strategies, but the key is really, how do we implement those strategies in your respective facilities? I just want to sort of one last question. Is there anything exciting in cardioprotection? What do you think are the exciting things coming down in terms of research, different interventions, different drugs? What's on the horizon that we can look forward to?
Well, one thing that I'm excited about are digital tools to help support from afar, as you mentioned, mobile apps and other ways that we can, even on a daily basis, have some interaction with patients virtually. I think that some patients find that really appealing, and as we're all on our phones more, however we can kind of continue to remind patients about the lifestyle recommendations that may be helpful from a cardioprotective standpoint. I think that's really exciting. I also think there are new medications. Of course, we have clinical trials ongoing of various strategies, and also of biomarkers that might help us figure out who's at highest risk, who's already experiencing asymptomatic cardiotoxicity, and therefore needs additional intervention.
Yeah, I think that's true. I think it is exciting to think that there are the potential to use technology and apps to try and engage patients so that they're more part of their care, that we are not always dictating to them, but they actually get involved in their care. And I can see that as being very important, especially around lifestyle intervention. And, the more I think about it, while we're fortunate to have drugs that can help for those people at very high risk, we can't forget that lifestyle changes can be equally effective, if not more effective. And just getting that information to patients and to other healthcare providers, about the importance of weight loss, diet, exercise, smoking cessation. All of these are so important. And I would argue in some cases are probably better, right, than taking another medication that may or may not be helpful. So exciting times, I think. Thank you very much for joining us, taking some time out of this meeting. But I think the important thing to remember, this is all about trying to improve the cardiovascular health of our individuals with cancer, and promoting this so that, while we're having great strides with curing cancer and patients are living longer with cancer, we'll make sure they have good cardiovascular health as well. So thank you for joining us today.
Thank you for the opportunity, and thanks for your efforts in this field. You guys are doing phenomenal work.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.